Hey everybody, it's Jessica DeMassa with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation, and today we are getting into that big triple merger that is creating a $2.4 billion value-based care kidney care company, and I am talking to the new CEO of that entity. It will be called InterWell Health, and you guys can please meet Bobby Sepucha. Bobby, it's great to have you here.
Thank you very much, Jess. It's great to be here.
I'm so excited to talk to you about this. So this merger brings together Cricket Health, Fresenius Health Partners, and you're gonna have to explain to us how that's different than big Fresenius in a second here, and InterWell Health, obviously the company whose name you're taking. So why don't you start there? And then what I want to do is not only hear a little bit about what each of those individual entities do, but also how the combination of this is going to create something even bigger and even better.
Sounds good. Yeah,
Okay.
we'll start with the component parts and we'll go from there. So,
Okay.
Cricket Health. I'm CEO of Cricket Health today. We are a value-based kidney care organization. We got started about a little over 5 years ago now, with the realization that kidney care in this country is broken, and it's got everything to do with the fact that there are about 600,000 Americans on dialysis today. All of the time, attention, focus, resources in this country for the last 30, 40, almost 50 years has been on the dialysis population. But there are 36 million Americans with kidney disease prior to kidney failure, and they, for the most part, have been wildly unmanaged. And so Cricket was founded with the premise of trying to improve the lives of every American with kidney disease, help them live their best lives, going upstream, identifying them early, and giving them the tools and the resources in the form of a rich library of information and also a multidisciplinary team that's theirs, a nurse, a dietitian, a social worker, a pharmacist, a patient peer mentor. It's theirs to communicate with, to better understand the disease and help them make the decisions that are going to be necessary so they can hopefully slow the progression of the disease. And even if they do progress, make the great decisions on transplant, on home dialysis, et cetera. So
All right.
that's Cricket. Go ahead.
We are going to get into like all of the ways that this might, impact Fresenius in a second here. So anybody who's chomping at the bit, Matthew Holt, I'm talking to you, hang in there, but keep going. So tell me a little bit about the Fresenius Health Partners piece of this, because I understand that's a value-based care arm of Fresenius, the mothership.
Exactly. So that's
Okay.
Cricket. And then Fresenius Health Partners, as you said, value-based care arm of Fresenius Medical Care, which is the largest dialysis company in the country and actually in the world as well. Fresenius Health Partners has been contracting with payers and with working with physicians to try and help them in value-based programs with the federal government. They have care coordinators, they have data and analytics, they've got a rich history of and experience set in value-based contracting. So Fresenius, the mothership, is spinning out all of those assets into this new company. So that's Cricket, that's Fresenius Health Partners. And then the third prong is InterWell Health. InterWell is a joint venture between Fresenius and about 600 nephrologists across the country. So it's a deep network of nephrologists who have come together to share best practices on value-based care and to work with each other as they enter into value-based contracts, particularly with the federal government as part of a new program that was just launched this past January. So you bring together Cricket's data analytics, patient engagement, and technology platform, Fresenius's deep experience in value-based care contracting, and then InterWell with their network of physicians. And the owners are number 600. The total network is about 1,600 docs across the country. So it's the platform, it's the experience, and it's the physicians.
Okay, so what us then? So the platform, the network, the physicians, so what? How is this going to really change the way that we're managing chronic kidney disease before it becomes really serious in patients?
Yeah, again, it goes back to the premise that we talked about earlier with Cricket. I think that for a long time, the focus has just been on dialysis and not on the entire patient, on the entire care journey. In recent years, you started to see entities like Cricket come into the fray. It's a very crowded market. It's a very competitive market in terms of trying to manage the total cost of care of these patients. And one of the things that's been challenging is to try and do it alone, to try and just be a care manager, working with a plan and saying, we'll take care of your patients or your members with kidney disease, and we'll improve outcomes and reduce costs. But unless and until you integrate tightly with the physicians themselves, then your success rate is probably going to be capped. You're not going to be able to really work with the patient on your care plan when that care plan may diverge from what their own physician is telling them. So when you tightly integrate with the practices, when you're all on the same page, when you're sharing data, then I think you can have a really deep, meaningful impact. I'll give you a very simple example.
Yeah, please.
The standard of care in this country, for a late stage kidney patient prior to kidney failure, you see your nephrologist, if at all, once a quarter, once every 6 months. So it's a very infrequent set of touch points. There's an awful lot of follow-up. this patient has just been diagnosed with kidney disease. They're staring down the barrel of a disease which may put them on dialysis. And if they progress, they have to decide, do I get a transplant? Do I dialyze at home? Do I dialyze in center? Arguably one of the single most important, profound, and difficult decisions to make in your final years of life. Having a consultation with a doctor once a quarter or maybe once a month, that's not a lot of time or support. So what Cricket has been able to do is to be the eyes and ears of the physicians between appointments, to do all of the follow-up that the doctors know they have to do, but just don't have the time or the resources to be able to do. So again, you put all of this together, then we're all singing off the same sheet of music and we're just doing better for patients.
And you guys too also have some tech that helps with like earlier identification and risk stratification, right? Say a little bit about that as well.
Absolutely. I mean, when Cricket started, we came with the premise and the sort of the insight that in order to make an impact here, we have to change patient behavior. And you can't do that unless and until you fundamentally change the way in which you engage patients. That's informed everything we've done, from the design of our care model to the technology platform we've built. But none of that is possible, or none of that it works unless and until you know who the patients are. And unfortunately, this has been such an underdiagnosed disease to date. And the reason is kidney disease is progressive, and only in the later stages, and really right before kidney failure, does the kidney take center stage and suddenly it's obvious that what's wrong with the patient. So what we've been able to do is to work with payers, work with systems, anyone who's at risk, and develop algorithms and techniques where we can mine their claims, just their claims, and identify with 96% accuracy, not just which member has kidney disease, but actually what stage of the disease they're at. Are they 3A, are they 4, are they 5? And so that can let us risk stratify them, who's high risk, who's low risk, and really deploy the care teams in a manner that helps them work with their disease at the moment it is. So it's a huge part of the program.
So from the Cricket perspective, it's like really it's augmenting that care team that you already had with the nephrologists that you're gaining access to via InterWell, and for the value-based contracting, so everybody gets paid via the Fresenius Health Partners piece. Yes?
I think that's exactly right.
More or less. Okay. No, that makes a lot of sense. Good. Okay. So how does this is the question I have to ask. So we had talked about my co-host on Health Tech Deals, Matthew Holt, and his big question about this deal was, is this like a takeout merger? Is Fresenius trying to take out Cricket out of the mix? Because I mean, seriously, if you guys do your job well here as InterWell Health, you're going to erode the Fresenius core business of providing dialysis, right? So how does this live alongside Fresenius?
Yeah, I suppose it comes as no surprise. I'm going to have to take issue with the healthcare curmudgeon and say, Matthew Holt, I think you're completely wrong. I think he's way off base. And here's the reason. The world is moving towards value. It is clear that we have to move beyond the fee-for-service way of doing business and focus more on how can we deliver the best outcomes for patients at the lowest cost possible. We've been doing it in primary care, and now that's moving into specialty. And no surprise, it's hit kidney care. Kidney care is probably 5 to 7 years behind primary care, at least in terms of making that migration. And no one in Fresenius is stupid. No one in anywhere, and no one in kidney care is dumb. We understand it's going to get there. What I think the realization that all of us have come to is, we know there are 5 or 6 things you need to do to thrive and succeed in value-based care. And I think no one's really put it all together. The network of physicians, the data and analytics, the contracting capability, the physician support, the patient engagement platform. And this, we think, is this combination makes the first entity that can do all of those things, that provides the physicians the support they need to do best by patients. And at the end of the day, I think that's going to help not just the patients, certainly, the payers as well. And yes, Fresenius. I think when you deliver a healthier patient to kidney failure, you don't obviate the need for dialysis. Unfortunately, no one has figured out just yet how to completely stop the progression of the disease and to help, to prevent kidney failure. When we do, that will be a miraculous day. But until that day comes, dialysis will be necessary. The key is, how do you deliver a healthier patient to kidney failure so that they are a better candidate for transplant, they're a better candidate for home dialysis, for other alternative therapies. And yeah, Fresenius is a big player in center dialysis. They're a big player in dialysis. So I don't think that their business is not going away anytime soon.
Does this expand the market in the same way that the shift in focus, like to pre-diabetes versus expanding that diabetes chronic care market, where all of a sudden we started taking a look at pre-diabetes so that we could potentially, help people not progress into that disease state, or as you just said, as far as kidney disease, when they do present with the disease, they're a little bit better off in terms of their own health and where they're at, and you know more about them as a business, where you're able to take care of them a little bit better. Is it similar to that in terms of the way that market is going to kind of like, I guess, telescope?
Yeah, I think so. I mean, I think, listen, there are more patients when you involve late stage kidney disease. Again, there are 600,000 Americans on dialysis. There are tens of millions in late stage kidney disease. So the population is just bigger. They're still very expensive. The total addressable market here we're talking about is on the order of $170 billion. I mean, the spend is just massive on both a unit cost basis and an aggregate basis. And just to be crass in terms of business terms, there's an awful lot of white space. There are a lot of patients, unfortunately, who don't have access to the kind of care that a value-based arrangement generates. There's too often it's siloed. It's the classic dilemma of American healthcare, where the primary care doc, if the patient has the good fortune of having a good primary care doc, is talking to the specialist, who's talking to the next specialist. This is a mechanism. Listen, taking a big step back, value-based care is about putting more financial and clinical accountability on the providers to do more for the patients. And the challenge in this sector is that the providers don't have the resources to be able to live up to those obligations and that accountability. And that's what this combined InterWell is all about.
All right, well, we are excited to see how this goes. I'm curious about what's next in terms of like where you're going to take this. So like the immediate next. So merger is a done deal. Like what happens like as you guys start to operate as InterWell Health? Like what is the beginning of this? So you're going to be running the combined entity. What are the first couple things to do in terms of your list for moving forward and operationalizing the new business?
I think first and foremost, it's getting the deal closed. So we've signed the deal. We announced that on Monday. It is subject to regulatory review. So we'll have a period where all three entities are going to continue business as usual until we get the deal closed, which we expect to happen later this year. Once we close the transaction, clearly the most important thing is making sure we're all doing right by our patients. And that is about getting the entities together and coordinating workflows, coordinating the clinical model. I couldn't be happier with the clinical results that we've been delivering here at Cricket. We're seeing significant reductions in hospitalizations, significant increases in the number of home dialysis starts and outpatient dialysis starts. Fresenius Health Partners and InterWell, as they work together, have created similar results. So I think we're going to be in great stead. What we're going to need to do is figure out, how do we all work together? The compatibility of the clinical models, to me, is one of the most exciting parts of this, and the complementary nature of all of the pieces coming together. This is not a situation where there's an awful lot of conflict. In fact, the data and analytics highly complements what they've been trying to figure out at InterWell in terms of how do we identify the high-risk patients. So we're going to take some time, make sure we figure out the right clinical model and put that in place. And then it's about just executing. I think we feel great about, we're going to have over 100,000 lives under management and more than $6 billion of medical spend under management. It's continuing to deliver phenomenal care to those patients and continuing to deliver strong economic outcomes for our payer partners in the form of reductions in savings. And then from there, we'll just try to continue to wash, rinse, repeat.
That's awesome. Well, very cool. Well, congratulations on this merger. It's an exciting space to watch. I know there's a lot of funding and there's a lot of competitors that are kind of out there and doing similar things, but we'll keep our eye on this because it does sound like a very unique approach. And I mean, you're backed by one of the biggest brands you are backed by the biggest brand in the space in Fresenius. So very exciting.
No, I appreciate it very much. And like you say, it is a crowded space. There's a lot going on. There's a lot of innovation. For those of us who've been in the kidney care space for a long time, it's arguably the most exciting time in a generation, if not more. We're happy to play a small part of it. And with any luck, we will continue to do great things for patients. So thanks a lot. I really appreciate it.
Oh my gosh, no problem. And happy National Kidney Month, because I do happen to know that March is National Kidney Month.
I'm impressed. Exactly right.
That's exactly right. So nice, good news to announce it at this perfect time. Bobby, thank you so much for joining us here. It's a pleasure to just hear a little bit more about the deal, like from the CEO of the new entity. So it's exciting to hear that. And I love the fact that you're willing to take on our resident healthcare curmudgeon and his curmudgeonliness when it comes to stuff like this.
Someone has to. I figured it might as well be me.
Thank you. I like to provide that format. A forum for taking him on. I love it. All right, Bobby. Well, thank you so much again for joining us. That's Bobby Sepucha. He is the CEO of InterWell Health, formerly the CEO of Cricket Health, or it still is until this merger closes. The merger is between his company, Cricket Health, like I said, InterWell Health, and Fresenius Health Partners. Bobby, thanks again for joining us. Pleasure talking to you.
Absolutely.
Thank you. All right. For those of you who want to check out more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It is youtube.com/WTF Health. And guess what, guys? I'm also a podcast. So look up WTF Health on Spotify and iTunes. We'll talk to you guys soon. Thanks so much. Bye.